Whether it's gum disease or possible athletic injury, more than 3 million teeth get knocked out of people's mouths in the United States due to trauma every year. And there's a new implant that is changing the way that dentists and dental surgeons are fixing those injuries. Dr. Sargon Lazarof joining us this morning. He's the inventor of this. It's called Ultratooth. Thanks for coming in this morning,
Thank
sir.
you.
Good to see you. So how did this all come about? Obviously, there was a need for this type of procedure.
Well, yeah, typically a dental implant, when you lose a tooth, you take it out, you lose the gum and bone, and before you put the tooth back, you have to have gum and bone surgeries, and then implant surgery, which takes time. And typically for a front tooth, it takes about 14 to 16 months to bring that tooth back. And that's because typical implants, the regular implants, are screws, which you have to place in bone, and you have to wait for the bone to heal. So 30 years ago, I came up with the idea of a molyball. Why not have a screw that goes in there and expands? So by doing that, we stabilize the implant immediately, so we can actually give you your final crown right there. So when I take a tooth out, I place this, replace the root, and then we can actually give you your final crown on without losing the gum and bone. So it saves you the loss and paying for gum and bone to come back. So
it's kind of like a drywall anchor that you put into your wall. It'll expand when you put the screw in. It's fascinating, and you can see the differences there.
Yes.
So you've had a lot of success with this. It must be a real joy for people when they're able to do this day of.
Absolutely. I've been doing this for 30 years, and currently we brought this to the market beginning of last year, and currently we have over 200 centers in the United States doing this procedure.
Wow.
So the wonderful news is that patients can go in, and if they're losing their teeth for any reason, if it's a failed root canal, broken tooth, gum disease, they can go in and ask for an Ultratooth, get a tooth, come out smiling and chewing right away.
And this is all FDA approved, which is a big deal as well.
Yes.
What was the process like that? It must have been a long one.
Yeah, it took 3 years. We had to submit studies and show it. And in 1994, actually, this became the first, and it's still only device that is approved for full functional loading. I mean, you hear about one-day implants and all that, which basically are dentures. You take a denture and they screw it in the mouth, and for that they have to take out all your good teeth, and some bone to make room for those dentures. That's the teeth in a day and all of that. This is not that at all. If you are missing 2 or 3 teeth, we can do that. We can do a full mouth, and it's your own gum and bone. So when see these cases when patients are smiling, it's not the denture. It's actually your teeth and gums that are showing.
Fascinating stuff. Doctor, thank you so much for joining us this morning and talking to us about Ultratooth. We really appreciate it. Where can people get more information if they'd like to learn more?
Ultratooth.com, Sargon Dental Implants. You can go to those sites.
Great.